Hi, this is Dr. Naveen Thiago Bashingam from Alpha Ortho Clinic, Pondicherry. This video is about elbow dislocations. Elbow dislocation is one of the most commonly seen dislocation in our practice. And in an elbow dislocation, the posterior type of dislocation is very common. This video is about posterior elbow dislocation only. Usually the patient presents with the elbow in semi-flexed position. It is essential to rule out either we are dealing with supracondylar extension type of fracture or posterior elbow dislocation. In posterior elbow dislocation, the olecranon is displaced posteriorly and proximally. Thereby, the triangular relationship between the epicondyles is lost. After confirming the dislocation, take a check X-ray and rule out associated fractures, understand the mechanism of reduction, give good pain relief with anesthesia, and put the patient in semi-supine position, give traction and counter traction as shown in this picture. First, hypersupinate the forearm, which unlocks the radius, then traction along the arm and the forearm. The third step is flexing the elbow, which stabilizes the reduction. Post-reduction, check the congruency of the reduction with check X-ray and document the neurovascular status. Thanks for watching this video. If you like to receive further videos, press the subscribe button below and the bell button on the side. Feel free to write your comments below. Thank you very much.